All right, so that was 10 minutes of being on the foam and 5 minutes of me leaning on the midline of your sacrum, especially at S1, 2, and 3, because sacrum has 5 levels, down 1 to 5, but the joint is formed at S1 and 2 and part of 3 typically. Okay, so now comes the question. Can I spring your sacrum? The answer is yes. Can I spring the ilium? Absolutely. And down towards your feet, yep. And going up, yes. And the ligament, I can now indent the ligament. So I'll check your chest and then we'll check your upper cervical. I can't find it. Okay?
Yeah.
I can't find the tight rib.
That's much nicer than it was before.
Good.
It's
Lie on your back. Keep talking.
It's funny that when you were applying the constant pressure, I got that cramping in the area where you said I had an issue, and now it's not as solid. Yeah.
Very good. All right, so we'll test traction, isolating the upper cervical spine. Boom, look at that. Now I'm going to spring it. Boom. It springs and it recoils. So let's have you walk down the hall and back.
Okay.
And then come sit in that chair in the hall and we'll ask how you feel.
Okay.
Okay?
Feels like I have more of a swagger than I did before.
Nice, nice. Go one more time because I was just focusing on filming here. So go once more and I'll watch you this time.
I don't feel as rigid.
Excellent, excellent. Very good.
It's kind of neat, really. It feels almost unsteady because I'm not used to it. Yeah.
Go ahead and sit in the chair and tell me how you feel.
Yeah, I'm always almost robotic with my leg movement.
Yeah,
you know?
and
it almost felt unsteady on my feet just a little bit because it feels,
interesting.
Feels
and
like
it's such a small movement of the pelvis, but it constrains movement of the pelvis as the pelvis moves on the hip. So it's not just that you lose that 2 millimeter of glide or 2 degree of rotation in your right and your left SI joint. It's more that it also constrains the freedom of the whole pelvis to move.
Right.
So it's more than restoring movement in the SI joint. It's restoring bigger movements.
Yeah. And that's why it feels like I have more of a sway, I guess.
Yeah.
It felt like.
Very good. How does sitting feel?
Sitting's not bad. It's hard to tell because you have a comfortable chair. Like when I sit on something hard like a bleacher, that's usually when I get my discomfort. But I feel good right now.
Okay.
I feel pretty even. Like I'm not favoring one side or another. I'll usually favor my right side to leave pressure off the left, but I feel comfortable sitting.
Good, good. So when the ligament softens as it did, I can now indent the ligament a little bit and give it a spring, and it'll spring slightly and bounce back with integrity. Underneath that ligament is the pudendal nerve. That pudendal nerve traverses, it has a tortuous course, but it does go between the sacrospinous and the sacrotuberous ligament. And with the sacrum glided posteriorly, that's going to put tension in all of your sacral nerves, to my way of thinking, especially the lower ones.
Okay.
So maybe we have less tension and compression on the pudendal nerves.
Okay.
So it'll be interesting to see how you respond to that. And for some folks, it's not immediate. It does take time. If you take pressure off a nerve, it needs to heal, and nerves heal very slowly.
Okay.
So it could be that in 3 months, you you know, you're doing much better than you are at the end of our 2 to 3 day visits. Anything else?
I know when you first found that tendon,
Right,
when you pressed on it, it's quite painful.
Oh,
Like when you first pushed and said it was very taut or like a rock, and then the second time I felt a give to it, and it wasn't as painful at all.
Nice. And like, how's the rest of your body?
I feel pretty good. Yeah.
So walk one more time and come tell us how you feel.
Okay. It feels different. Yeah.
Sometimes it takes walking more than once, you know?
Yeah.
So tell me, you're laughing.
Yeah, it feels like someone else's legs. Like I don't know, I've been so cramped up so long in that area that it feels like I have play.
Yeah.
Like almost like a ball joint or something.
There you go. Like it got lubricated. Maybe.
Yeah.
And then how does your neck feel any different? Your upper body?
It's hard to tell. It feels a little tight actually on this side, but not painful or anything.
Okay. Alrighty. And the way I work is that I don't teach you anything on day one about what you can do to keep this. Okay. You know, this is usually a one-time and done. It's fixed because we use intelligent direction of force, sustained force. I mean, that was 10 minutes, you know? Yeah. And so it really should stay mobile. And now every time you walk, these structures find their normal movement just reflexively. So you don't even have to think about it. And it's going to keep lubricating that joint, those farther ranges that weren't getting the lubricant, you know? Okay. So it could be the case that maybe tomorrow you come back and there's a little bit of a different pattern, and then I'll treat that pattern, and that might be your core pattern. Okay. That's my terminology. And so there could be something to be treated tomorrow, but it takes usually 24 hours to really see it. Okay. So we'll stop here, and then of course I'll want to do long-term follow-up with you and see how things improve. Okay. Thank you very much.
Sounds good. Thank you.